All right, you guys, welcome, welcome. It is December 2019, another year almost under our belts. And I'm curious if it's been a positive year, a pleasant year, a year of growth, a year of change, or maybe it was a really icky year and you just can't wait to get it past you. So let me just see where you guys are tuning into from today. Are you from cold, snowy places? I don't see any of you. So feel free to chat. I wanted to tell you, I'm happy to answer questions. I want you to use this time for support after I talk with Dr. Sabrina today. And feel free to ask your questions in the bottom in the Q&A section, or you can put it in the chat box. And Julie says it's been positive and a growth year. So Julie, I want you to take that in for a minute. With all of you, whatever kind of year it was, if it was a positive, pleasant year or not so pleasant, just give yourself credit for whatever it is you're feeling right now. And if it was a really crappy year, maybe there is one event, one moment that you had that was pleasant or maybe positive. Because so much gets held up in our bodies. So if you're hurting, if you're stressed out, if you're having health challenges, I like to get to the root cause of what could be contributing to the life pains that you're having, the physical pain, the emotional pain. And today I brought on Dr. Sabrina Salt, and I'll introduce her in a moment. And she's local here in Phoenix, Arizona, and she does wonderful work naturopathically with regenerative injections for pain, such as PRP, prolotherapy, and she's even talented to harvest stem cells for stem cell injections for pain. Not only that, she is a hormone specialist, and she really knows her hormones, and also really just looking at general nutrition. And she loves to use and has a wealth of knowledge with nutritional IVs, and that is vitamins that are injected into you intravenously. And this is often a way to boost your immune system. A lot of people, when I worked back with people working through cancer, had done nutritional IVs of vitamin C, Myers cocktails, all of those things. And we'll talk about that a little bit if you have questions at the end. Okay. So let's just see. And hi, Dr. Sabrina.
Hello, can you hear me?
I can.
Okay, great. Is it coming in clear?
Yes, coming in clear.
Perfect.
Can you guys hear pretty good? All right, so I'm going to unpin my video. So I'm talking, it'll show me, and then it'll show to you, unless I don't think we could do, yeah, can we, yeah, perfect. Technology, yay. So yeah, Dr. Sabrina, we got to work together. You came in and we did an intensive, and I have this special secret skill. And I have a lot of training in it, and I call it the emotion technique that I do, because when we get in touch with emotion, we get more motion in our bodies. And I was so excited to be able to treat you, because not only do you do one of the things that I absolutely love for pain is regenerative injections, and your wealth of knowledge in that, but I was able to show you what I do with my hands, which can be like magic.
Yes, your analogy that your hands are like scalpels was spot on. Yeah.
And what was funny was you got off the table after what we did 4 hours or so.
We did 4 hours. Yeah, about that. Crazy.
And you just went, oh my God, I don't even know how to describe what you did.
Exactly. I didn't, but I knew that we needed to tell people about what had happened, because it's so important what you're doing. And it's like a certain degree of magic, if I'm being entirely honest. And I think that we should just give people a deep dive into what actually happened and what it is that you have the ability to do and how you can help people. It's so important.
Mm-hmm. Okay, and we're gonna get into the deep details. And I was like, Dr. Sabrina, are you sure you want to talk about all of this? Because it's very personal, it's very, very intimate. And I'm just trying to think of where to start. It's so much, because I'm just going to share why I want you on to talk, because I'm really, the hardest part of my job is I have these amazing skills that I can help people. And I tend to help people who have tried everything, they've given up, they're frustrated, they spent thousands of dollars on all kinds of crazy treatments. When I ask for, when I do an intake with my new clients in the assessment, they've tried everything and they're burnt out and they don't believe that I can help them. And then they
Mhm.
say, well, let me find someone in my area that can help. And I think part of my gift was nearly dying and having so many parts of my body broken. And I do want to talk at the end about what you do, because that was one of the treatments that really helped me with my pain. But it's not a massage. It's
Yeah.
energy work. It's hands on. My hands are scalpels, and we look at those hidden traumas underneath what's causing pain. And I blend, like I said, that emotion technique that I use. We got to get in touch with the traumas, and they get trapped in your body almost like a hologram, and we need to release those. And so it's a very amazing technique, and so we're going to talk about it. But I'm trying to think of where to start, because we talked, and I'll just say it and you can tell your side of the story. But Dr. Sabrina, she is a mother of a beautiful 22-month-old little girl. She's just perfect in every way. I fell in love with her. And she wants to get pregnant with her second child. And she's been trying, and she's, 22 months postpartum. So you've had
Mhm.
Zoe, and you're trying to get pregnant, and to no avail, nothing's happening. And it's
Yeah.
super frustrating. So you go ahead with your part.
Yeah, so I think we were just having that conversation one day when we were together, and I was telling you about, this is what's been going on for us, and it was very easy for us to get pregnant with Zoe, so there was no issues there, um, and it never really even occurred to me that there could have been some trauma there, something that's preventing it. And being the doctor, being the one that's, skilled in hormones and stuff like that, I'm like, it's got to be the hormones, it's got to be this, it's got to be that. And I've been trying all of these things on myself for months and nothing's been happening. So when, we were discussing this and Phaedra told me that, doing some work might actually be the thing that moves the needle, I was like, well, we might as well give it a shot, right? I mean, worst case scenario, we're back where we started. Best case, maybe I can get pregnant. So after that discussion, we decided on a day and time, and I truly did not know what to expect going into this. We booked it for a Saturday afternoon because that was the time that we both had available in our schedule. And initially, when she sent me the booking email, it was set for 2.5 hours. I said, okay, great. It's going to be a couple hours. I was like, what? I'll even take you out to dinner after. It's going to be awesome. Little did I know, 4 hours later, and it was an experience to say the least. Yeah, it was great.
And that's what I do, is like, I know what it's like to be in pain. So I
Mhm.
will do whatever it takes to help my clients get out of it. And, I had to check in with you, like, because sometimes it can be painful. It's not all
Yeah.
painful. But
Yeah.
if you haven't been taking care of yourself, or like you, people don't know how hard it is for naturopathic school, and how many, like, how crazy that is. And you sit all the time. And when you sit, your pelvis gets extremely tight and has problems. And
Hmm.
tell them how you used your body before, even what your
Yeah.
specialty was.
So I was a former athlete. I played soccer all through high school. I was a competitive fitness athlete too. I did bikini competitions all throughout med school. So no stranger to plenty of exercise and keeping strong muscle tone. But also during med school, like Phaedra was saying, you're constantly sitting, you're constantly hunched over, you're studying, you're clenching your jaw, you're very, very tense all the time. There's professors and doctors on shift yelling at you and you have to do all these things. And it's just a total, it's, it's great experience. I wouldn't do it again though.
So be nice
A
to your
lot of stress.
naturopathic doctors.
Yes, that we do go through a lot, but it's wonderful being able to do what I do at the end of it, but it does put you through a lot. And I think the most interesting thing about doing the treatment with you was that you landed on areas that I didn't even know were a problem until you kind of woke them up. Things like the jaw pain, things like the stuff that was in my lats. It was it was so interesting seeing you find those things and then work them out and then seeing how I felt in my body afterwards.
How did it, well, I want to get into the jaw stuff and your experience with that because it's amazing and it's crazy and I want people to know about it. How does it compare? Is it like a massage at all?
It is nothing like a massage. The only thing that they have in common is that you're on a table and she's using her hands.
Mm-hmm.
That's it. It's next level. I think with a massage, there's a few different ways you can do a massage. You can do the really gentle stuff where it's super relaxing and calming. You can do the really deep tissue stuff where they're digging in and they're using motion and they're trying to like push the knots out almost. Your technique, yes, it's hands-on. Yes, there is some pressure applied, but it's almost like you're working with the body to kind of gently coax it out of whatever it's holding on to. You know, almost like when you go to therapy and you're talking to your therapist and they're gently trying to coax you into being a better person. That's like what you did for my body.
And sometimes though, I do go deep.
Yes.
But the thing is with the massage, as far as like, so again, the underlying piece is the nervous system. So with massage, think about it on, off, whether it's fingers or elbows. So you're trying to relax and then they hit a spot and it's like your nervous system's like, whoa, am I safe? I have to figure this out and realize it. I go there, get you connected with it, and then we stay there until you and I together work on processing it and the fascia unravels. Did you experience that? Because there were times where I could tell you were off thinking about something.
Yes, because sometimes you're holding these positions for what seems like a really long time, and I'm sure that it was. I mean, we were there for 4 hours, and she's wanting to get it to release, and I obviously want to get it to release, but it's just not releasing. So it's easy to let my mind go and think about, oh, this is what I have to do later. This is what I have to make for dinner. This is that. This is that. And then she gently kind of brings me back and says, okay, come back into your body, go into that area, see what's coming up and try to go and work through that. Really helps.
Right. It's almost like a psychotherapy experience too. And when we're on an area and that area isn't letting go, it isn't releasing, nothing's happening. And what it feels like when stuff's happening is it's warm and there's this movement and fluidity and I can sink down and things just magically unravel and move. And so when we're dissociated and we've had traumas, it could impact us. And I told you, I know you're wanting to have a baby and well, we'll get to your trauma about that. I want you to tell your story, but really there was a trauma there and it wasn't releasing. And you had a really, so everybody is different. Every body is different based on how you move, based on your history. Heck, based on how you were born into this world, your body gets set. And then you look at all the activities you've done in your life, the sports you've played. I know I asked you, have you fallen on your tailbone? It was like, oh yeah, probably a million times. Yeah. And as we get older, it starts to show up in the body. Okay. And Julie's asking, did you have pain issues you were dealing with? Yes.
Oh, yes. Yes. There's a whole other part to my story beyond the fertility issues where I was definitely dealing with some upper back stuff, some neck stuff, and even some lower back stuff too that I think was a result of some of the pelvic issues. But yes, there was definite pain there.
Your shoulder blades, and like most people, like I know how to work shoulder blades, but you can't work the neck and shoulder until you go in and you do the jaw. And you had literally steel beams there in your scapulas. Now, she's harvesting stem cells and doing injections that way. Think about what any profession is doing. You're stabilizing with one hand, reaching with another, leaning over a patient. And it's just like all of us on the computer or like a dentist I've worked with terrible necks. So how we move and how we use our body is important. And then whatever falls, injuries, surgeries, traumas you've had, it starts to impact you. So let's start with the mouth, and I'm going to show a visual, and you could talk about it because you you had a jaw issue, but you didn't really know how bad it was, right?
I certainly didn't. So I've been a teeth clencher for, I would say, most of my adult life, and I think it's just a stress thing. I had braces as a teenager, and I think just the stress from that too, it resets your jaw. It makes things really, really difficult. So one thing that I will say is that all of the stuff on my left side was so much worse than my right side. So that was really, really interesting to learn. But yeah, so a lot of tension in my jaw, and like I can just feel it. And I've injected myself in my own jaw to try to relieve some of the pressure. Like that's how bad it's been. I will put needles in myself. So once we got in there, it was, I think that I had tears at one point, if I remember correctly. Like I was welling up. It was pretty gnarly, but it was also great too, getting to see the release in real time.
You felt it.
Absolutely.
Can you just kind of describe what that felt like?
So, oh man,
Because like I put my finger in a gloved hand into kind of, there's muscles attached on, and I grab this bone and my finger goes to the back of the molar here where there's muscles. And it was like solid rock hard and didn't want to let go.
Yeah, that was the ones that were up here, the ones that she's talking about, those ones, and then the ones that were internally right at the very back of my jaw, those were the absolute worst. And it's like almost like a hot poker when she puts her finger in there and presses on that and starts to release it. But then slowly it's like buttery at the end of it. It gets so relaxed and easy. And I didn't clench my jaw, or I almost couldn't clench my jaw for a good couple days afterwards. I notice a little bit now, but I think I'm still stressed. I think we do need to do that another treatment like you were talking about. But I told her the next day I woke up and I had not clenched at all. And usually I wake up every morning and I'm like prying my jaw open because it was just clenched shut the whole night.
And you were a little sore, but like I said, we literally remodeled you. And you guys don't realize how tight you are until you really get in there. And if you raise your arm and there's a pull or there's a burn, chances are there's a fascial restriction. And that's important. And if you guys look at this skeleton, and I bet you don't even realize you have all these bones there. And our brain sits up in there. And, this is something to help decompress the nervous system manually, because we are stressed clenching our jaw, which pulls on our neck, which pulls on our shoulders, which then pulls on our belly. And so we've got to release that. So when I go in, my intention is to work all of these the muscles that are compressing these bones together. And you guys could even check, if you take your finger up on the roof of your mouth, you can feel, and maybe you have more space between the teeth and the right side than in the middle. So see if like left side versus right side, if there's a difference in there. And we have muscles that pull that together. And I have skills to help open all of this up. And I think I did work in your nostrils, didn't I?
We did go in the nostrils too. Yes, that was super interesting. I also have sinus stuff too. I mean, I feel like I'm broken talking about all of this, but yeah, I did have some sinus issues too. And immediately upon her working the sinuses, they opened up and I could breathe better. I didn't even know I could breathe poorly at that time. Like you don't know how bad it is until she gets in there and makes it better.
And that's the thing is, there's not a lot of people that do as much as what I do. And again, it's because I have been there in my own pain healing, and I've spent thousands and thousands and thousands of dollars on training and working with the best of the best to blend it all together. So we did the jaw, we did cranial first, because you want to open up all the skull bones. Then you want to work in the mouth, and then we move to the neck, and we still have more to do. But our main goal was to do the pelvic floor work to help you get pregnant, because something's going on. And I said, well, what happened? What was the birth like of Zoe, your first child? So that's the hidden trauma. I'm sure you didn't even think that could have made you clench, hold, bracing inside your cervix and your uterus. So share with everybody what happened when you delivered your first child.
Yeah, so we her due date was approaching and gone, and I wasn't dilating the way that I should have been. And my physician, my OB-GYN at the time, he said that one of the options that I had was something called a Foley catheter. And basically what this does is it's a very gentle way of inducing labor, because what they do is they place this catheter into the vaginal canal and actually into the cervix, and then they gently inflate it to artificially dilate the cervix in hopes that it kind of triggers the body into doing the rest of the dilation on its own. It was super effective. I had it done at like 2:30 in the afternoon or something like that. I was in the hospital ready to going into labor by 10:30 or so that night. However, when I got to the hospital, as I was in triage and they're checking my vitals and making sure that they can take me back, the nurse that was doing the pelvic exam, she noticed that the catheter had actually went up, passed through the cervix, and was inside my uterus, and my daughter's head was on top of the bulb. So it was stuck in there. And at that point in time, my cervix had only dilated to 6 centimeters. So there wasn't a lot of space in there. But this nurse had to get up in there into the cervix with her hand and pull out that catheter before I could even go and like basically get into the hospital. So that was a lot of pain, a lot of discomfort, and I guess really, really traumatic. And then during the birth itself, I did end up having a tear and had that stitched up. And you just don't really think that these things are going to hold in your body. You think that you're going to go through the birth, you're going to go home with your child, and everything's going to go back together, which it basically did. Besides the fact that since then, certain aspects of intercourse have been painful. And, you know, love my husband, amazing guy. He's been very gentle with me, very patient with me. And, you know, we're battling the pain during intercourse, we're battling the infertility, and we keep trying to push through it. And I do have to say that after we did that treatment, I have not had any pain. Mm-hmm. So that's been really nice too. So that's kind of what we were looking to address, is the traumas that happened after that birth.
And so we were doing pelvic floor work, and I want to tell people about this. And there's an Elle magazine article, you put what where. And so we do work internally, vaginally and rectally with people. And men, we do more rectal. Obviously, women, we do vaginal and rectal. And it's so powerful. So if you are having pain with intercourse, bladder issues, any type of rectal burning, any weird nervy pain, sciatic pain, I like to free up the fascia and free up the muscles. And then literally there's such like a tight ball sometimes. And I think with you were guarding and protecting. That was such a traumatic scene in the triage in the hospital. And I can't help but think that there's this bracing that then happens.
Yeah, I think you're spot on.
Right. And so honestly, most therapists, et cetera, won't look at all of these pictures, but I can feel your pain and know, hey, I'm struggling. I want to get pregnant, Phaedra. What can I do? And I was like, I can help you. So we go in, and I literally could not feel her cervix at all.
I couldn't even find it myself. It was the strangest thing. It was like it had just gone and disappeared.
Sucked up into her chest cavity.
Basically, it was so much higher up than it should have been. And I think it was just all of that guarding that I had been doing since the birth, because, you know, a strange nurse went in there and just grabbed at it and went inside and pulled out this catheter. So I think that there was definitely, you know, my body just doing its protective mechanism and trying to prevent any further trauma. Oh, sorry, my light just went off in here. Mm-hmm.
And so what we were doing is, again, to reach it, and I'm going to do a screen share for anatomy purposes, just to teach you guys. So if you've had any type, gallbladder surgery, appendix removed, hysterectomy, C-sections, oh my God, they tend to root down. Scar tissue happens, and I say scar tissue is like dried gum on a sidewalk, and it's so stuck you can't even get it off. And that's what the scar tissue does. So I'm not gonna lie, truth be told, it was painful for you. The whole, the first part, it was very hard.
Yep. Yes, very. It was a totally different type of pain. It wasn't like birth pain. It wasn't like cramping, period pain. It wasn't like anything I've ever experienced. It was the release of everything.
So if we go in here to my little skeleton, and we get a close up here, and if we look at the anatomy, so I never remember if the plus is a male or a female. So let's just see. Oh, there's the male. I'm like, what is this little muscle here? Okay, so I'm going to put the muscles back on so you guys see the anatomy. And so if you think about Dr. Sabrina in med school, well, first of all, she was in fitness competition. So she was working out, doing squats all the time. So leg muscles, and look at how the leg muscles attach up into the pelvis. Okay. And then sit-ups, and then maybe sitting at the desk, rounded forward. So ribs. So if you guys do this with me, your ribs fold in towards the pelvis, towards the pubic bone. And if you spend a good majority of your day sitting at a desk or a computer, working or driving your kids around all over the place, it does start to shorten up and get tight. So I'm going to remove some of these muscles so you can see the deeper part of everything that we dealt with, and you can see the pelvic floor muscles. And this needs to be addressed. So if I talk to you and we have a call and I'm like, I know I can help you, it's because nobody else is going into these areas and releasing them. And a little quick rub by the massage therapist isn't enough. We got to go in energetically, intuitively, intuition, and intentionally and unravel. Then I bring her into the scene of that, what was it, the triage room.
Mm-hmm.
And what did I have you do? Do you remember?
Rewrite the story. You had me rewrite the story in my head about how it happened.
And do you remember what happened when you went in and you did that?
We talked about how it was easy. There was no trauma there. I went in and I breezed through, and it was such an easy labor, easy delivery. I was safe. Nothing happened. It was great.
And your muscles in my hands literally unraveled.
Mm-hmm.
And, you know, this is quantum physics. It's greater than we even know about life. But if we can get in touch with those hidden traumas that we have in our body, if you had a car accident, if you had a whiplash, what if you were driving and what if you looked in the mirror and you saw the person and you got out of the way? I do the trauma renegotiating when my hands are on you and things unravel. That's what's different than all these fancy other massage therapies, neuromuscular therapy, all of that. And those have their place, and I do receive them myself, but there's nothing like when you can release those hidden traumas that are keeping you stuck. So if you're going and getting all these treatments and you're not making progress, I say chances are there's something hidden in there. Or there's a life situation that's getting frustrating for you. And I know for you, it's getting frustrating. What's wrong? Is something wrong with me that I can't get pregnant yet? I'm a doctor. I'm gluten-free. I'm dairy-free. I should be no problem getting pregnant. Mm-hmm. So, and you said you noticed some changes since that. You messaged me the other day.
Yes. So the first thing that I did notice was that the jaw stuff improved greatly. The pain during sex in certain positions, that has gone. And then finally, I'm not sure how much your listeners are familiar with the different changes that happen with vaginal discharge as you go throughout your menstrual cycle. Well, I actually hadn't had a menstrual cycle in, it's probably been 3.5 years or something like that. So it's since the one right before I got pregnant with my daughter. And so I didn't even know if I was ovulating at this point, because.
And you're still breastfeeding.
And I am still breastfeeding, but women, it's possible to ovulate and get pregnant while you're breastfeeding. So I didn't even know if I had ovulated in that time period at all. But what was super interesting was that after we did the treatment, the next day or the day after, I don't remember which day it was, but I actually got that change in the vaginal discharge that would indicate possibly ovulation. So I'm super optimistic because that happened very, very quickly. And I think it might have just been a matter of getting stuff back into place, because we did end up finding my cervix after all.
It took like 2 hours.
It was a challenge. It was hidden in there, and it was actually hidden very up high and on my left side. So if you remember before, I was saying a lot of stuff on my left side was way worse. So I'm wondering if because all of the things were tight over here, that it was just kind of yanking it up in that direction. But yeah, so we had to release that.
Absolutely. So let's just kind of go in and look at some structures. And then one of the big muscles too, I think this definitely, okay, so muscles in the belly are like key to get released so you can help your pain. Your neck pain, your shoulder pains, your leg pains, your vaginal pains, your back pains. It's key. The belly, basically the belly is the front side of your back. And I want to keep some of these organs in here. Here's your stomach. So if you're having digestive issues, chances are you could be having some restrictions here as well. But these are obliques. And then we've got this psoas muscle here. And that's huge, you guys. If you are sitting a lot, and even like, well, Dr. Sabrina is kind of like leaning into the desk. I do it all the time. And what that's doing is it's starting to jam over time my clavicle into my neck. And how many years are we doing this? She's only 30, so she's got plenty of time before, but it starts to add up. So you got to get the belly released. And there are not a lot of people that do it. And I'll be getting a massage and I'll say, hey, can you work on the belly? And then they do the traditional, I'm going to work the way of the colon and all the intestines move, but we got to go deep in there to free up the psoas so you can stand up straighter, so you can lie flat without any back pain. So that's the first part, and that has so many attachments all the way along the spine. So it's kind of the side of the spine. And how I get there, and I had you do this because we have, obviously the cervix is under here, and we couldn't get it down. It was so like stuck up. So I go into the rib cage, and if we look, let's see if I can make this, the diaphragm is up under here. So hang in there. This sometimes doesn't like to cooperate. So we've got the liver. You can see the liver's right there. I'm going to take the liver out. And again, so I look at things structurally that they could be stuck in impacting your health. So that's kind of what my forte is in looking at the emotional piece. But if you look a little closer here, sorry, it's taking a while, but this is the diaphragm muscle. It's a big fat muscle. And so that was sucked up on you, and it's sucked up on a lot of people. I had you sit at the end of the table, and I dug my hands in up under the ribs to get the diaphragm. And that was like, ah. And then we go in to release all of these. This is the QL. It goes from the lowest rib into the hip. This is causing your guys' back pain. So if you're not twisting well and you're kind of like, you bend over and you start to feel a back pain, I find chances are your QL's really, really tight. So my theory was we're going to get that cervix down. We've got to work away from the area, because I couldn't find it. So we're basically like pushing her organs down with my hands so I can reach them, getting her connected in with her body and dealing with the trauma release so that that cervix can drop down and I could finally release it. And when I was working in there, there were nodules. There were these tight, clenchy balls of things in there that needed to be released. And then if we go down even further, so again, the psoas is super important. And then we have the iliacus. And if you're sitting, chances are this is really, really short and it needs to be elongated. And it just improves blood flow, lymph flow. The pressure gets taken off of the nerves. So I'm going to go and take out the organs, I think. And I want you then to get a close look into the pelvic floor. So one of the self-treatment tips I could give you guys is if you take a tennis ball and you sit on it on the anus, and if it hurts, it just means you've got a tight pelvic floor. So hang in there with me. So again, we're going to just do a view up here, and we have a lot of muscles there. And a lot of times women are very shy to have this work done. But this is, in my opinion, the healthcare of the future. So we go in and we're working on bringing down where's the uterus attached to, where are the ovaries, and you felt those pains. You felt the scar tissue from having to be surgically sutured up.
Yep.
Yeah.
Definitely. Yep. And what was really interesting was that, even during intercourse, I would get like a sharp stabbing pain kind of in the region of my right ovary. Mm-hmm. So there's definitely some displacement there.
Yep. And now things are gone. Your cycle, the fluid, because again, if you are doing maybe more the natural birth control method, there's apps for it. You keep track. It has you check your discharge. Is it silky and smooth and slippery, or is it clumpy? It'll determine what area in your cycle you're at. And that has changed for you since we did that work.
Yeah, very, very quickly. So I'm interested to see, because right now, the discharge does look like I'm ovulating. So I'm interested to see, one, if I end up getting pregnant on this cycle, or if I end up even having a menstrual cycle for the first time in, almost 3 years. So
Mhm.
we'll see.
Yes, and this is so important for any age, anybody at any age to get this freed up. And I find it's the healthcare of the future.
I agree. I think everybody needs to do some degree of this at some point. We all have hidden traumas. We've all got stuff that we've gone through. We've all got parts of our body that just aren't working the way that they should be. And our body does work in harmony. Everything is connected. So we need to be able to focus and help those areas that need that extra TLC to get things moving again.
Mm-hmm. And so you felt much more release in your jaw, in your neck and
Yes.
shoulders. You probably didn't even realize you had so much pain.
No, and especially the area that I was really not sure of was when we did the lat stuff, and also some of the breast releases that we did. So those were interesting too, and working on that.
Do you want to talk about that?
We can, yeah. So I've got breast implants, and I've had them since June of 2016.
Why?
And self-esteem issues. I shared with Phaedra this picture that it's a picture from my husband and I from our wedding. So it wasn't his influence. He married me without fake boobs. So it was totally me. And this picture, it was so cute, minus the fact that my arm was up holding my bouquet, and my strapless dress was no longer being held up by the lack of chest that was there. And it had dipped down, and you could see like the little stuffing that I had in there. And it was just so sad to me. And I said, you know what? Time to get implants. And I do have to say, I really, really loved them for a very long time. And this is a story that the full thing that we don't need to get into, but then I did start getting some issues with them. And if you're not familiar with the term breast implant illness, it is totally a legitimate thing. And it is something that we don't have enough time to dive into on here, but know that there is some other trauma that's living up in this area as well too.
And you
Especially,
didn't feel it though. I want to say is like, you're
yeah.
like, oh, I'm fine. But we got into those scars
Mm-hmm.
and you felt
Yes. Yes, totally felt it, because when they cut you to put them in, they're cutting, pretty much all the way down to the bone, and because they're going underneath the muscle. And yeah, those scars, I didn't realize how much was in there. It was a lot.
And this goes for anybody who's watching who has any kind of scar. And I know this because I have my own scars. And they went in, and I had screws in my ankle, and they went into the same scar and they took out the screws. So when you go in twice, it's doubly hard, and it will limit your range of motion and cause pain. Just like the surgery, well, the pulling out the catheter during your pregnancy, and they had to stitch you up. Well, that's why I'm having pain with intercourse. So we do need to address the scars. And it was funny because you didn't really even report any problems there. You're like, oh, I just want to get them out. I knew that this causing me not to feel well, but you didn't think about the scars.
Did not think about those at all.
We literally took your breast off of the rib cage, off of the chest wall, and pulled it forward. And we all need that. We all do. Especially if you're having very fibrous cystic breast with mammograms, you can actually go in and help loosen up the dense tissue.
And that was what was really cool, is that you actually were able to let me feel the difference on each side. Once you had worked on one side and then I had felt the other, and you could actually feel a difference in the tissue. The side that she had initially worked on, it was like more silky and smooth and soft, and the other side was definitely just hanging on there a lot more.
And like I said, you guys, this works. And that's why I brought Dr. Sabrina on, because it's hard for me because I have this magical knowledge and I talk with you guys. And I want you, if you're hurting, do whatever it takes to get released, because your nervous system's in your body too. And I hope that life has gotten, it's only been a week. But I hope life for you this week is maybe a little more manageable. And I know you have some changes going on at home with your daughter too. So I hope that you're able maybe to cope better. Your body's adjusting your nervous system.
Absolutely. I have definitely felt better. I was definitely sore the first couple days, but I have felt better. Even my workouts, I'm still working out. I do feel a little bit stronger. I can move a little bit better. So lots of positive changes just from one treatment.
And when we go in and we unravel the muscle that's in a tight, hard ball, so when it's tight and hard, it's not its full capacity for strength. So when we
Mm-hmm.
elongate it to its natural position, you get so much more power. And, I'm not a huge fan of Kegel exercises, actually, if we think about it. And a lot of people teach that, but we're already tight, hard, and shortened in there. And then you're going to go in and squeeze them. It's good to bring body awareness there, but I'm still on the fence. I would say do the pelvic floor work first and then do the Kegels. And not all pelvic floor therapists are the same in their training. So for her, what we did with Sabrina was we changed positions
Yes.
to
Yes.
really, because when we change positions, our structure changes. Our muscles either shorten or elongate, and that's how we were able. Like we were trying everything we could to, and I think we were pretty effective with it. And we'll do more, but I think that it was a good start, and it was so exciting. It was great to, you got off the table and you're like, I just don't know what just happened.
Yes, it was a total trip, and it's interesting because you're the one being worked on, but it takes a lot out of you too. Like I mentioned before, I was like, "Oh, I'll take you for dinner afterwards," and I was like, "I'm sorry, I owe you dinner, but I just have to go home." It was an experience, that's for sure, and you do end up tired. And what was another thing that was really
Well, not
interesting too?
everybody, but what I will say is sometimes, because a
Mhm.
lot of us, especially busy women, are in the sympathetic dominance and fight, like we're ready to go, like
Yeah,
all the time. And really, we got you decompressed. We got your nervous system unwound from the crazy busy. And
yeah,
so sometimes that's completely opposite when we're so relaxed after.
yeah.
It's
I
so
think that's what it was.
opposite than every day. And so I say that's what it was. Everyone says I'm tired, but it's like, no, you were finally not stressed out of your mind.
Totally. That does make the most sense. It was awesome. I
And so
really
you were
enjoyed
going
it.
to say some more
What was I going to
about,
say?
you said you were tired and then you went home.
Oh, yes. And something that was really interesting. And I think this has a lot to deal with, like, this might be a little bit woo for people, but the energetic release of that trauma, I actually ended up having some nightmares over the next couple of days. Some nightmares and then some more really vivid dreams. Like I remembered a lot of my dreams over the last few days. So that was really interesting too. So something happened subconsciously.
Yeah, and you got more REM sleep probably too.
Yes, I did do that
So
as well.
that's where the dreams come in. So that's really beautiful. Okay, so anybody watching have any questions? Because I do kind of want to tie in what you do now and share, because
Yeah.
you do some magic stuff too. And I believe I'd like to, before I get an injection like Prolo, PRP, or anything else, I like to get a massage, get my body opened up, my muscles opened up to be able to receive the injection. So why don't you tell people about you and what you do?
Yes, so I specialize in regenerative medicine. So I use different tools that are there to help your body stimulate and heal itself. So things like PRP, which is a product that we get from your own blood. I also do things like harvest your own stem cells from your fat or bone marrow and put those in areas that need the attention. I'll also do things like prolotherapy, which just uses like a simple dextrose solution. And all of these things have different places in certain different disease processes or certain orthopedic applications, and they work phenomenal. I can't even tell you the results that I've had over the last, I'd say 3 or so years that I've been focused on this field of medicine. And it's giving people hope back that didn't have hope in other ways of medicine. They didn't have it for them. And I'm also saving people from surgery too, which I love doing that. Surgery, there's a time and a place for it, absolutely. But if you don't need to undergo surgery, I am happy to save you from it.
Mhm.
In conjunction with the regenerative medicine, like Phaedra said, I do a lot of hormone replacement therapies and bioidentical hormones. And it's really important to actually have that piece in with the regenerative medicine. And it's because regenerative medicine, the whole premise of it is that we're going to stimulate the body and we're going to signal to the body. Well, your number one signalers in your body right now are actually your hormones. So we need to get that signaling sound and working well before we can add in some extra stuff. So I love the hormone component, and plus I get my patients feeling amazing with optimized hormones. And then finally, the third piece with that that's really complementary are the nutritional IVs that I do. And that's just because we're giving the body these potent high doses of vitamins, minerals, amino acids that the body needs in order to grow, build, heal, and repair in conjunction with doing these other therapies. So we get some amazing results, and we're doing it with natural means. And that's what I love the most.
It is. And so I got a question for you, because
Yes.
a lot of women that I speak to who are postmenopausal, they aren't oftentimes getting their labs done, and they're not doing hormone replacement. But first, is bioidentical safe, and who should be doing bioidentical hormones?
Bioidenticals are 100% safe. And honestly, every woman postmenopausal should be on bioidentical hormones. The research there isn't even a question on anymore on the research. It is 100% safe for women, as long as they don't already have existing cancers. But it's not going to cause cancer. It's not going to hurt you. It's going to make you feel better. An example that I like to tell people is just with estrogen. So estrogen is the hormone that tanks when women hit menopause. And that's when you start to see the symptoms like hot flashes and vaginal dryness, and, of course, just all the other things that come with menopause. Now, estrogen in the female body has about 500 different functions. When estrogen starts to drop off when women hit menopause, well, all those functions, well, now they're unsatisfied, right? They're just not happening. And some of these functions are tremendously important. The number one thing being how estrogen is protective for the heart. Did you know that the number one killer of postmenopausal women is actually heart disease? And it's because of their low estrogen levels. So, I mean, just getting women on hormone replacement therapy, we can take down the number one killer of postmenopausal women. So that alone should be a reason to do it. Not only the fact that you're going to feel amazing, you're going to look amazing, your skin's going to be glowing, and you're just going to have all these other positive benefits. And then, of course, the testosterone too, which is actually appropriate for both men and women. And with women, you know that you have low testosterone when you start seeing things, of course, like low libido. But another thing that's a low testosterone symptom in women is when you start getting the brain fog, when you start losing that word that you're just about to say, when you forget where you put your keys. That's not just old age, that's tanked testosterone. You need to get your levels checked. Absolutely.
And what about fatigue? I hear a lot of women are just, well, I know it's a stressful world. The world's changing, but they've got a lot of fatigue all day long.
Fatigue can be your testosterone, it can be your estrogen, it can also be your thyroid, and it can even be your vitamin D levels. So you got to really make sure you're getting that comprehensive panel from a provider that is very familiar with how to do optimal levels of hormones using bioidentical means.
And often what people say is, oh, I've had my hormones checked and the doctor said I'm normal.
So we don't want normal when it comes to hormones. So this is something that I really have to educate my patients on, and I spend a ton of time doing this, is that when you look at your lab results and you look at those reference values, I want you to just throw those away, okay? Because all those reference values is an average that the lab took of a sampling of like 1,000 people. It doesn't mean anything. When we talk about hormone replacement therapy, the example that I like to use is, let's pretend I asked you to go play a game of golf right now and there was $1,000 riding on this game and you had to win. Would you want to golf like yourself, or would you want to golf like Tiger Woods? You'd probably want to golf like Tiger Woods, right? That's optimal levels versus normal levels when it comes to hormones. I want you to have the Tiger Woods level of hormones every time.
So I'm just going to speak and maybe I'm not knowing what I'm talking about, but if I look at my labs, they're in the normal range, but they're on that lower end.
Mm-hmm.
So that's probably, chances are, I need supplementation. So
absolutely,
that what people can get a copy of your labs, keep them on file, keep them handy, and talk to your doctor. And then you have to push sometimes, even especially thyroid. A lot of people aren't on it and they need it.
Or find oftentimes your primary care doctor just doesn't know hormones the way that they need to because they're too busy being a primary care doctor. They don't have the time to go to the extra training, and it's to no fault of their own. They just don't know. They don't understand. They don't see the new research because they're so busy caring for the primary care needs of their patients. That's why it's so important to find a doctor who is completely literate in bioidentical hormone replacement therapy. I know personally I was trained using the BioTE method, BIOTE, and they actually have a national provider registry. So you can just go on their website and find another provider, and we pretty much have the same way of practicing and looking at labs. You can also go on A4M, like the letter 4, or the letter A, the number 4, the letter M, and their website. You can usually find provider through them that's been trained in hormone replacement therapy too.
Okay, and one thing last to touch upon is belly fat, stubborn belly fat.
Ooh, okay. So many things we could go here with this. The first thing, so I always like to check hormones first because I want to just establish a basis for health, and I want to make sure everything in your body is running the way that it should be. And oftentimes we see things fall out from that. The second thing that I always look at is food intolerances and food allergies. Your body is going to want to hold on to inflammation and hold on to stored energy, which is your fat, right? Your body's very, very intelligent. It's going to store energy. And the abdomen is a very easy place and a very accessible place for it to store it. So having those food allergies tested, if you're eating things that you shouldn't be, your body is going to be storing food and fat in this area in case you're not getting the nutrients that you need. And this happens when you're eating foods that you shouldn't be, because your body doesn't want them there and it sees them as a threat. So it thinks threat coming in, save the stores for a time when there's no longer a threat, and that's when you start to see the belly fat creep in. So food allergy panels are super, super important. But generally the things that I see come up for a lot of people are things like gluten, dairy, soy, corn, and sometimes even eggs. So those are always a good start for most people to just do a trial elimination diet of.
Okay, and what about related to hormones and belly fat?
Oh my gosh, all of the low hormones can contribute to belly fat. Your low testosterone can, your low estrogen can, your low thyroid, all of them.
Okay. Wow. Well, thanks for being here and sharing your intimate story with us. And now we're all just going to be waiting to see. You guys have to, I mean, her daughter is like perfect. She's blonde. Her and her husband, they're the cutest couple. And they're dark hair. And she is just blonde as could be. She's smart as a whip. It commands the whole restaurant. She's so adorable. And I just wish you baby number 2 soon enough and in divine timing, right?
I hope so. And you'll be the first to know.
All right. So I'm just going to leave it open. Does anyone have any questions? And again, you can put them in the Q&A box or the chat box if you have any questions for us. Don't be shy. All right. Or raise a hand if you have a question. No takers. All right. Well, thank you guys for being here. Thank you, Dr. Sabrina. Oh, Julie's asking, what self-care do you do?
Ooh, how much time do we got? So beginning of my day, couple days, 2 or 3 times a week, I start with a workout in the morning. The rest of the days of the week, I start with a morning meditation. And then I do my shower. I finish on cold in my shower all the time. It's doing hard things first thing in the morning sets you up for success later in the day. It just gets your nervous system going. So I have to be very disciplined with that. And that is an aspect of self-care. For the most part, I actually do intermittent fasting, pretty much 5 or 6 days out of the week. And my eating window is usually between noon and 8 p.m. Outside of that, I usually just have water, black coffee. And then as far as what I do eat, my diet is gluten-free, dairy-free, soy-free, corn-free, and yet I still spent $140 on groceries the other day, right? So I'm still, still eating. There's still plenty of food to eat even after you take all of that out, but it's very much a whole foods-based diet, and we do buy pretty much, I'd say 90% organic. I do see a therapist once a week because I think it's important to be able to just talk out some of the stuff that goes on a daily basis. Being in the healthcare field, and of course, just having my own, oh, sorry, that light again. Being in the healthcare field, and of course, just having all the stuff that I'm dealing with myself, I think it's so important to have somebody as a sounding board and somebody to work through that stuff with. And then I do massage once in a while. I also do chiropractic care a couple times a week. And I also go to this place locally in Phoenix. It's called Optimize. And there I'll do compression, I'll do cold plunges, infrared sauna, and also red light therapy. So that's my self-care in a nutshell.
Yeah, I'm trying to think like what I did this week. Again, it's so much. I'm doing transcranial magnetic stimulation. I'm doing one-on-one Pilates through insurance. I'm doing Z Health technique, which is really, really interesting. I had a massage, and I like to teach him what to do. And sometimes this past week, he was very open to hearing some of my techniques because I know which body parts to release. And sometimes it's frustrating when I'm like, can you just do this? And you tell them and they're still not listening. So just keep trying, guys. I have a meal service now that gets delivered. It's gluten-free, dairy-free autoimmune protocol, which is helpful. I found a great dharmaocean.org is an amazing meditation program I'm doing right now, and I really am integrating it into my day where in the somatic work that I do and I teach my clients that you can learn to regulate your own nervous system and really shift out of the stress response because really stress kills us. So good. And I think I do have a therapist, but they're all booked. So I do go and I see her occasionally when I can get in with her. And I do float tanks. Have you ever done that,
Yes,
Sabrina?
I have. Yes, I've done it one time before.
And I love that it's 1,000 pounds of magnesium Epsom salt and you just float and you can close the hatch. So you're in almost a sensory deprivation tank. So you could have no lights or you could have relaxing music. And that's pretty amazing. And you have your daughter you get to play with, but
I do. She's the best type of self-care. It's so nice to be able to just relax and just kind of get into her world and just see things the way she does and just be free to play with her.
Yep. Yep. That's so beautiful. So it looks like we have one hand up and we'll try. Roma, are you available to talk? I don't know if this will work. Let's see. So Roma, if you want to ask your question, just unmute yourself. Let's see. All right, looks like it's not working. Or she's not on. Oh, hi Roma. I was gonna see if you had a question. We just need you to unmute yourself. Bottom left.
There we go.
Hi.
Hi, how are you? My question was really for my daughter. She's 43 years old and she had dysgerminoma when she was 13, ovarian cancer. So had the ovary removed with major surgery. And then at 14, they thought it was in the other ovary, so they did the whole surgery again, thinking they were removing that ovary. It wasn't, it had just hemorrhaged. And she's 43 now. About 18 months ago, no, longer than that, 3 years ago, she had a little girl who was 7 months old and got into hospital with emergency pain, abdomen, all of that. And they didn't do any scans and things till very late, and so it was very, very late in the piece when they discovered that she had a burst appendix, which had turned gangrenous. And so she had emergency surgery for that. So she's got lots of scar tissue everywhere. Mm-hmm. And I was just wondering what your thoughts were on a person with that medical history going on hormone replacement therapy. She's kind of in perimenopause now. So,
yeah, it would be completely beneficial for her. It's not going to interfere with any of the scar tissue that's in there, but it's going to be helpful for her just navigating the rest of her life with optimal levels. And oftentimes too, getting optimal hormones can help reduce some pain as well.
Yeah, she has a lot of pain. She's been diagnosed with fibromyalgia, which I have too. And so that's a bit of a battle. And she's a very, very active person, on the go all the time. And so, yeah, I just, I kind of was in the menopause stage, I suppose, when all the scary stuff came out about, risks of breast cancer. My sister's had breast cancer twice, and with a daughter with the ovarian cancer history, it kind of puts you off. And yeah, it's changed. I think information has changed a little bit today, as you were saying. on the benefits as opposed to any risks. But I heard you mention, as long as there's no cancer state, and so it just made me think of her and her, what her risks would be, or how wise it would be if you've already had that in your medical history.
She should definitely contact her doctor and get a thorough treatment plan and a workup with them for sure.
Yes. Yeah.
And with all the surgeries, and this is something I'm dealing with, being in a coma, broken bones, and I think I got a bladder infection while I was in the ICU. They pump you with antibiotics when you have surgery. So that could also be really, her gut health needs to be looked at too. And I'm researching some protocols to help with the gut for myself too. 10, 11 years later, I'm still having some issues. So that's something to look at, her gut healing too. And surgeries cause the scar tissue, and she's got a lot of it. So getting work done on the belly. And if she's got back pain, hip pain, rib pain, hip pain, it's definitely could be related to the surgery.
She's had a sort of a ballet background, and she's what they call, hyper flexible.
Hypermobile. And then when dancers, I don't know, Sabrina, were you a dancer?
I was up until age 8, I think.
Because I think it's when that preteen, there's a lot of emotional body image stuff or stress that could happen.
Lots of body image stuff.
And so I would look at that too, because oftentimes there are those hidden traumas underneath the fibromyalgia, is what I see. And there's that emotional trauma. And now it's like, I had cancer. Is it going to come back? Do I have to have another surgery? Right. She had all these surprise surgeries coming. And so if I were working with her, we would help give her body a pre-warning of the trauma of the surgery. Whereas we would renegotiate, rewrite it as if she knew it was happening and it was planned.
Yeah, I mean, she danced till she was 15, and then because of the consecutive surgeries that were major, she sort of, when you that level ballet school, you sort of, you feel like you've missed out a bit, and so you can't catch up with exams and stuff like that. But she ended up with lipidemia, which is apparently fairly common when you have the abdominal surgeries and things. So she's quite a small person, but more puffiness in arms and legs and a small torso sort of thing. So there's always been a body image, and I think when such a young child has had such surgeries and stuff like that, it's a bit of a shock to the mind that doesn't easily go away. So
yes, absolutely. So thank you for sharing.
And I wish you were closer to Australia.
I'd love to come. That's on my wish list.
You're welcome.
There is a place in Perth. I know Perth is far from everywhere, but there is a place that does it in Perth.
Oh, I'm in South Australia, so I'm in the middle at the bottom. So Perth is 3 hours that way, and the others are 3 or 4 hours that way. So
Well, thank you so much, and best of luck, and just love your daughter. It's hard when you're in this pain and this emotional, physical pain, and we almost feel we can't express it anymore. But life's just a little harder for her, and
But so she's very positive. She's a very positive person. Yeah. Okay. Thanks a lot, Phaedra. Thank you
so much.
Bye.
All right, and then we have one more question. Sabrina can answer.
Oh, is that the one that you had sent me?
Yep.
Okay, so if a woman still has a menstrual cycle, she does not need estrogen. She very likely only needs progesterone and testosterone. That being said, if a woman is suffering with migraines that occur during her menstrual cycle, and they're like clockwork every single time, she would be a candidate for estrogen therapy, because that can actually help with the migraines. So that would be the only situation where a woman is still menstruating where she could have estrogen.
Okay. And what about red light therapy? Someone wants to know what red light therapy does.
Oh, yeah. So it's got a host of benefits. So all of your cells actually have photoreceptors on them, and they respond to different wavelengths of light. Most notably, which I'm sure you guys have heard, is the cells in your eyes can respond to blue light, and that's why we have blue light blocking glasses. You can turn the blue light off on your phone, because the exposure to it can, it can inhibit your melatonin production, make it hard for you to go to sleep. Well, all the other cells on your body are very, very receptive to red light, which can actually help increase collagen production. It keeps you looking young. What it can also do is it can help increase your hormones. So I've actually had a couple gentlemen that I've tested their hormones pre and post starting red light therapy, and we've seen an increase in their testosterone by significant amounts. I'm talking like 100 or 200 points. And all they did was expose themselves to red light. So it's really neat.
How do people expose themselves to red light?
Most basic thing you could do is actually just go outside and get the full spectrum of UV light on your skin. And so there's actually an app that you can download. It's called D-Minder, and it will actually tell you the best times to go out and get vitamin D and how long you should stay out for based on what you're wearing. But the other thing you could do is buy a red light device or go somewhere that has one. There are companies that actually manufacture these.
Great. Yeah, they're definitely popping up everywhere.
Mm-hmm.
So, awesome. Well, Dr. Sabrina Salt, thank you so much for being here today. And like I said, if anyone wants to come, do an intensive treatment, we can bring Dr. Sabrina in too and help you navigate your journey with your hormones as well as your pain spots, because regenerative medicine, and we touched upon it, it's really powerful. And it's what I also did, what keeps me pain-free, even though I have a broken bone in my leg.
Absolutely. Thank you so much for having me. I got to go pick up my daughter, so perfect timing.
Great. Awesome. So best of luck to you on your healing journey too. We all have it. We're not perfect, so we all have stuff that we're working on. So take care, guys. I'll see you next week.
Bye.
Bye.